Thank you for coming on the line with us today. My name is John Dubas. I'm with Premier Senior Benefits, and for the next 45 minutes or so, we'll be discussing Medicare Advantage plans working with TRICARE for Life and VA programs. Today we're going to look to define veteran insurance and benefit programs, including TRICARE for Life and VA programs, and we'll speak to how those programs coordinate with Medicare Advantage and Part D plans, and an opportunity to supply additional health care coverage to folks in these categories. We'll also speak to the enrollment opportunities that are available to these beneficiaries and determine next steps. When we deal with TRICARE for Life beneficiaries, we're looking at a program that's a health insurance program for qualified military individuals and their beneficiaries based on years of service. TRICARE for Life is the program for qualified Medicare beneficiaries and their Medicare retirees and their beneficiaries. If they're on TRICARE and have Medicare Parts A and B, they get or apply for, in certain situations, TRICARE for Life when they become eligible for the Medicare Part B benefits. TRICARE for Life, the military program, is administered by CMS, the Centers for Medicare and Medicaid Services. When you deal with coordination of benefits, this is one of the areas where we're going to look at what a person gains by joining an MAPD program and what limitations are placed upon that veteran when they join a Medicare Advantage prescription drug plan. When you look at the coordination of benefits between the programs, for most of the services, when the care someone receives is covered by both Medicare and TRICARE for Life, they'll have zero out-of-pocket expense. After Medicare pays its portion of the claim, TRICARE for Life will pay the remaining amount due. It's up to Medicare to approve a service for payment, and if Medicare doesn't pay because it decides that care is not medically necessary, TRICARE for Life will also not pay for that service. TRICARE for Life beneficiaries can appeal Medicare's decision, and if Medicare reconsiders and provides some coverage, TRICARE for Life will also reconsider that coverage. There are different enrollment rules for TRICARE for Life, and these recipients can enroll into an MAPD or an MA-only Medicare Advantage plan. But if the TRICARE for Life recipient enrolls in an MAPD, it could affect their ability to access drug benefits on TRICARE for Life. As a company, some of the different carriers out there have decided to do an MA-only sales opportunity because of that circumstance. It's important to note that if a TRICARE for Life recipient asks for an enrollment in an MAPD after being informed of their risk to TRICARE for Life benefits, the sales agent must continue with that enrollment. If you do so, I would strongly recommend you document all circumstances applicable to that case. When you look at some of the philosophies that come as part of a Medicare Advantage plan, they have a focus on health and wellness benefits, and they emphasize preventative screenings. They would provide a veteran more physicians to choose from while allowing the choice to continue to still use military treatment facilities if desired. Keep in mind that members of a Medicare Advantage health plan must receive all medical care from plan providers except under emergent or urgent care situations or for out-of-area renal dialysis. If that member receives care without authorization from a non-plan provider, neither the Medicare Advantage plan, Medicare, or TRICARE would pay for those services. So you have to be careful in those circumstances. It's important to note, too, that Medicare Advantage plans help manage and prevent chronic illnesses with targeted disease and health management programs, and they offer predictable co-payments, which may also offer some financial predictability in certain circumstances, for example, using or during catastrophic episodes of illness. When you look at Medicare Advantage plans in conjunction with TRICARE for Life, it's important to remember that when an individual joins a Medicare Advantage health plan, they don't lose the security of their TRICARE for Life benefits. They add the Medicare Advantage plan benefits, and they can continue to receive drug coverage through the TRICARE pharmacy program. If they are enrolled in a Medicare prescription drug plan, a PDP, and enroll in a Medicare Advantage health plan, they will automatically be disenrolled from that PDP like any other circumstance. They are asked to choose a primary care physician from the network of doctors in the MAPD plan, and they receive that care for the Medicare Advantage program through those health care providers, although there may be certain restrictions. And those restrictions include using plan providers except for an emergent or urgent care situation or for those out-of-area renal dialysis services. It's also important to note that that individual can still choose to continue to receive care from the military treatment facility. And in many circumstances, they can get these benefits without additional plan premiums. Obviously, they have to satisfy the regular requirements of having both Medicare Part A and B, reside in the service area, and continue to pay that Part B premium if it's not paid for by Medicaid or a different third party. It's important to note that any other health insurance being designated as OHI in this particular circumstance, any other health insurance plan in addition to TRICARE coverage is considered to be the primary health coverage. So OHI is considered any non-TRICARE health insurance received through an employer or other public or private insurance program, including government programs such as Medicare. If the beneficiary has other health insurance, it's important they tell the provider and the regional contractor, and that they fill out the OHI form located in the TRICARE Choices booklet or on the regional contractor's website. Keeping that regional contractor informed about OHI allows TRICARE to better coordinate benefits and helps ensure that there are no delays in payment of claims. When you have both Medicare Advantage plans and TRICARE for Life, here's how the payment works. You pay no extra monthly cost beyond the Medicare Part B premium if the plan doesn't have an additional premium to it. In many circumstances, you pay zero for many routine services. And this can vary from plan to plan, but that includes certain doctor visits and preventative screenings. There may be circumstances where small co-payments are required for major medical services. This includes hospitalization for any length of stay. In those cases, it'd be necessary to submit a claim to TRICARE for Life for full reimbursement to take the TFL beneficiary to a zero cost basis. In some circumstances, on certain plans, there will be a 20% coinsurance on certain covered services. These include radiation therapy, durable medical equipment, certain types of physical therapy, and in those circumstances, a claim to TRICARE for Life for full reimbursement would be required again as well. It is important to note for a person that has other health insurance, OHI, that they complete a claim form that can be obtained, as I mentioned before, from the TRICARE website or in person through the benefit counselors back at the military base. The submission requirements are based on instructions that are part of the claim form, and that benefit counselor at the base can assist in completing the form for reimbursement for TRICARE for Life. Why would a TFL beneficiary add Medicare Advantage programs? Well, it can add to their benefit package that might include additional preventative care, routine vision, hearing, and dental care if part of the program. It does allow for worldwide emergency and urgent care. It helps with their diabetic monitoring supplies, and in many circumstances, dependent upon the plan, there may be health club memberships available without additional cost to the member as well. Medicare Advantage does have that emphasis on preventative care, so it allows for that routine annual physical exam coverage without cost. It can help with preventative dental, including zero copays for a certain number of visits dependent upon the plan. It also allows for routine hearing examinations and hearing aid allowances in addition to free bone mass measurement. It also, in many circumstances, provides a routine annual eye exam coverage with allowances for eyewear. That coverage amount can vary and does vary from plan to plan. An important part that needs to be considered very carefully as well is the fact that Medicare Advantage adds to the worldwide emergency and urgent care that a person wouldn't have or has on a limited basis with TRICARE for Life. And this gives the beneficiary the coverage they need when traveling anywhere in the world. It generally supplies that care for a reasonable copayment for those emergency services and a copayment for urgent care services, which again can vary from plan to plan. Additionally, many of these plans provide zero diabetic monitoring supplies cost. That includes a glucose monitor, blood glucose test strips, ketone urine test strips, lancets, and Lancer injector devices. These, if a person needs to test very regularly, can add up to some major expenditures. Additionally, one of the things that comes as part of a Medicare Advantage program are the disease management programs, which help to manage chronic diseases such as cancer, diabetes, congestive heart failure, chronic obstructive pulmonary disease, COPD. Some differences that you can use as a chart in circumstances when you're looking at the monthly health plan premium. When you look at original Medicare and TRICARE for Life, there isn't a premium if you have just those two programs. And in many circumstances, that premium will remain zero even if you add an MA plan. Depends upon the plan. Health club memberships are generally not covered with original Medicare and TRICARE for Life. And in many circumstances, they are a benefit with certain MA plans at no additional cost. It does make a difference as well when you deal with inpatient hospital stays. If you have original Medicare and TRICARE for Life, it has a zero deductible up front, but then TRICARE for an in-network hospital charges $250 a day or 25% of the institutional charges, whichever is less, plus 20% of the professional charges. And if the hospital in use is a non-network hospital, it's more than twice that, $535 a day or 25% of the institutional charges, whichever is less, plus 25% of the professional charges. So the doctors that see the individual, the ones that consult, everything else that comes into play, even, for example, an anesthesiologist, which is used in surgery in a non-network hospital, there's an additional 25%. The MA programs generally have a small copayment for a certain number of days depending upon the plan and the benefit period, and the expenditures are generally limited to those small copayments, which do vary from plan to plan. When you look at worldwide emergency care for original Medicare and TRICARE for Life, the person is a beneficiary is responsible for 25% of the TRICARE allowable charges, where with a Medicare Advantage plan and TRICARE for Life, it generally is limited to a small copayment that varies from program to program. An annual physical, routine annual physical, is not covered with original Medicare and TRICARE for Life. There are the limited health screenings that come with original Medicare that come into play, but generally when you deal with a Medicare Advantage plan in conjunction with the TRICARE for Life coverage, that routine physical is generally covered without cost. When you look at bone mass measurement, which is particularly important when dealing with an individual who's dealing with either osteopenia or osteoporosis, with original Medicare and TRICARE for Life, that is a 20% charge responsibility to the beneficiary, where in most plans with Medicare Advantage involved, it's a zero copayment. It's important to note that the beneficiaries other than active duty family members are required to purchase Medicare Part B and must pay that appropriate Part B program when you deal with a Medicare Advantage program and with TRICARE for Life. Some of the ancillary benefit comparisons: when you deal with vision coverages, the routine eye exam and eyewear is generally not covered with original Medicare and TRICARE for Life. With many of the MA plans, the eye exam is covered in full, and it has an allowance for the eyewear itself, be it glasses or contact lenses. When you look at hearing coverages, a routine hearing exam and hearing aid allowance is generally not covered with original Medicare and TRICARE for Life. and those are covered with co-payments or certain allowances in many of the MA plans. When you look at preventative dental, those are not covered with original Medicare and TRICARE for Life, or in many circumstances with the Medicare Advantage plans, it's a varying co-payment. You generally have 2 exams available per year as part of that coverage. If you look at the diabetic monitoring supplies, original Medicare and TRICARE for Life leaves a 20% co-insurance to the beneficiary, where in most cases that's covered in full with the MA programs with TRICARE for Life. Here is a listing of many of the contacts that come into play for folks that have TRICARE for Life, and it lists the different regional carriers and contacts for TRICARE for Life offices. Keep in mind today's presentation is being recorded, and it, along with a number of other resources, will be sent to you as part of the follow-up to today's presentation. So keep in mind, when you look at some of these different coverages, there are certain benefits that are covered fully by Medicare Advantage, where there is a co-payment if an individual just has TRICARE for Life and original Medicare. That is because many of those coverages were not intended to be fully covered with original Medicare. Some additional contact information that might be helpful in your discussion with TFL beneficiaries. Here is the contact information for the TRICARE Retiree Dental Program. The TRICARE Dental Program in its purpose for folks that aren't yet on TFL. You have the contact information for the TRICARE Retail Pharmacy Program and the Mail Order Pharmacy Program as well. If you have additional questions as to coverages with TRICARE, here is the contact number with the 1-888 DOD CARE contact information, toll-free number for TRICARE, and the website address as well. When you deal with individuals that do not have TRICARE for Life but have veterans benefits, you're looking at a bit of a different animal. And keep in mind that this program goes back to the Civil War, where President Lincoln was concerned and aware of the need to address care for wounded veterans. When you deal with Veterans Affairs benefits, each state sets specific criteria for the state-specific veteran benefits. And for federal medical benefits, they come from the Department of Veterans Affairs hospitals, if that situation was established prior to September 7th of 1980. And in those circumstances, the veteran must have served at least 180 days of active duty. After that date, the veteran must have served at least 24 months. If the veteran was medically discharged and received a VA service-connected disability stipend, the time limits are not applicable. Different set of rules. When you look at VA benefits, the VA categorizes veterans into 8 priority groups and several additional subgroups based on factors such as service-connected disabilities and one's income and assets adjusted for the local cost of living. If you have a veteran with 50% or higher service-connected disability, such as determined by a VA regional hospital, or pardon me, regional office rating board, such as losing a limb in battle, post-traumatic stress disorder, etc., these are provided comprehensive care and medication at no charges. Veterans with lesser qualifying factors who exceed a predefined income threshold have to make co-payments for that care for non-service connected ailments and must pay $8 per 30-day supply for each prescription benefit. Some of the basic factors that go into determining eligibility for health benefits. Eligibility for most veteran health care benefits is based solely on active military service in the Army, Navy, Air Force, Marines, or Coast Guard, or the Merchant Marines if you go back to World War II, and they were discharged under circumstances other than dishonorable conditions. Reservists and National Guard members who were called to active duty by a federal executive order qualify for VA health benefits as well. and returning service members, including reservist or National Guard members who served on active duty in the theater of combat operations, have special eligibility for hospital care, medical services, and nursing home care for 5 years following discharge from active duty. Keep in mind, healthcare eligibility is not just for those who served in combat. Other groups may be eligible for some health benefits as well. Veterans health care is not just for service-connected injuries or medical conditions. That is a factor in the priority of treatment. Veterans health care facilities are not just for men either. The VA offers full-service health care for women veterans as well. When you deal with certain subset of Veteran Affairs benefits and you go to dental and nursing home care, these are more restricted in nature. Dental benefits are limited to service-connected dental conditions or to veterans who are permanently and totally disabled from service-connected causes. Hearing aids and eyeglasses will only be provided in special circumstances and not for common hearing or vision loss. When you look at how the Medicare enrollment rules affect VA benefits, VA beneficiaries can enroll in an MA-only plan, an MAPD plan, or a PDP program. If they enroll in a Medicare Advantage plan or a standalone PDP plan, prescription drug plan, it doesn't override or impede access to VA benefits. They can use both. VA benefits, however, must be accessed through VA providers. Medicare and or PDP benefits must be accessed through contracted civilian providers. There's the difference. If a civilian physician writes a prescription and the individual goes to the VA to have it filled, it won't happen. It has to be written by a VA doctor, a VA provider. There are additional Medicare enrollment rules that are enforced for VA, and when an individual is enrolled in an MAPD or PDP program, that beneficiary can choose to have the prescriptions written or filled by either a VA provider or pharmacy or a civilian provider pharmacy. Keep in mind that the orders cannot be crossed. A VA beneficiary enrolled in MAPD cannot fill a prescription written by the MAPD network physician, the civilian, at a VA pharmacy. Noted that just in the slide prior. The copay rates are lower due, in many circumstances, due to drug classification on the VA formulary. So you have that list of drugs that come into play as well. What you see in many circumstances for many veterans is, let's say they get the flu. They go to a civilian doctor that's close rather than traveling a distance to a VA facility. That civilian doctor prescribes a medication. They can take it to a contracted civilian facility to have it filled if they have the drug coverage either integrated into their Medicare Advantage plan or as part of a standalone prescription drug plan, Part D program. If the veteran joins a Medicare prescription plan and also uses the VA healthcare prescription benefits, the veteran's copayment of their VA medication does not apply to their true out-of-pocket cost regarding the catastrophic benefits under their standalone plans. They're considered distinctly separate. So one doesn't play into the other when it comes to the cost of the two programs affecting the other. Many folks will ask if a veteran can be enrolled in both the Medicare Part D and the VA system. And keep in mind that the VA medical benefits are separate from Medicare, so the veteran can be enrolled in both programs, but the enrollment process and the eligibility criteria is distinct for each. So they may qualify for one and not the other. The hot link on this will take you to those frequently asked questions for specifics. It's important to note that a VA benefit program, that health insurance program, is neither health insurance, so to speak, or an HMO. The VA health benefits are established by federal law and regulations and are funded through different appropriations. They are not the same as an insurance contract, and veterans do not pay monthly premiums to receive VA health care. In addition, the beneficiary is not required to use VA as its exclusive health care provider. So if they have outside health insurance or eligibility for other programs such as Medicare, Medicaid, or Champus, they can continue to use those services under those programs. The VA actually recommends that if you have other health insurance coverage or HMO coverage, you keep that coverage in place to provide the beneficiary with options and flexibility for the future. You will run into many veterans in many circumstances that will say, well, should I cancel or decline my Medicare coverage? The VA doesn't recommend that veterans cancel or decline coverage in Medicare or any other health care or insurance programs solely because they're enrolled in the VA program. Unlike Medicare, which offers the same benefits for all enrollees, the VA assigns enrollees priority levels based on a variety of eligibility factors, including service connection and income. And there's no guarantee that in subsequent years Congress will appropriate sufficient medical care funds to VA to take care of all the enrollment priority groups. So this could leave certain veterans, especially those that are enrolled in one of the lower priority groups, no access to VA health care coverage. And for this reason, having a secondary source of coverage may be in a veteran's best interest. Keep in mind also, there are the stories of the waits for care that may be incurred for lower priority groups when accessing care through a VA facility. That flexibility can make a big difference for a veteran, particularly like in circumstances that we noted before when it comes to time and location of getting a prescription filled. And there is also the circumstance that there may be certain prescription drugs that are not on the VA formulary that may well be filled by the civilian providers, particularly under the Part D programs. It is important to note, and this is often a topic of discussion when you visit with veterans who have not picked up additional coverage outside of the VA, that the late enrollment penalties in Medicare Part B and Part D that are imposed to those that don't enroll during their initial enrollment period, well, VA care is recognized as credible coverage for Medicare Part D, the prescription drug program, but it is not credible coverage for Part B, which is the outpatient health care including doctors programs. So even though the veteran might avoid the late enrollment penalty for Part D by citing the VA coverage, that enrollment would not help them avoid the late enrollment penalty for Part D. And remember, that's 10% of the premium for each year that they do not have it in place. For one of the questions that was posed earlier in the presentation in the questions area, what are some of the benefits and disadvantages for joining programs? Well, if you look at some of the disadvantages, sometimes it's the old real estate question of location, location, location. The VA facility could be several miles away where the available plan network under the Medicare Advantage program could be much closer and more easily accessible for the beneficiary. It's also important to note that VA facilities have rotating specialist schedules, so that veteran may not see the same physician each and every time, where within the Medicare Advantage program, the person can set up that relationship with a particular doctor or provider and have it work out where they can establish that relationship. It is important to note, too, that there are different formularies that are involved. The VA formulary in certain circumstances may make certain medications available on a generic basis less expensive than a standalone civilian program, but in many cases the civilian programs may have additional drugs available that aren't available through the VA. Keep in mind, too, that those extra benefits to help cover dental and vision programs may be available only to certain qualified veterans, where they're generally accessible to all members of a Medicare Advantage or a Medicare Advantage only plan if they're available to anyone within that particular program. Many times the co-payments for different charges based on someone's of a regular income are much less expensive on a Medicare Advantage plan, and Medicare Advantage programs in many circumstances cover the hospitalization charges more economically than just VA coverage. Once again, keep in mind that VA benefits are considered creditable coverage for the prescription drug program and exempts the person from the late enrollment penalty for Part D plans. But VA benefits are not creditable coverage when you deal with a medical circumstance for Part B. It's also important to note that VA benefits, while they count as creditable coverage, do not act as a special enrollment program. So while it does enable the veteran not to have to be subjected to the financial penalty, it doesn't allow them to enroll mid-year on a standalone basis. There are other circumstances where a VA beneficiary may be eligible for a different type of special enrollment period, but it's not based just on them having VA coverage. So what do we do when we deal with a veteran? Obviously, it's part of our diagnosis process of asking questions and listening carefully to the responses. Consider what that veteran's current needs and lifestyle dictates, and recommend coverages to supplement their current coverages if they're needed. These folks also tend to congregate and are in contact with people that are veterans like themselves. Many of them go to different types of programs where they visit with other veterans. You may be able to receive additional referrals, both for individuals and for group speaking opportunities as well. And always, always remember to thank the veteran for the service that they have performed on behalf of our country and for us that take advantage of their sacrifice. You have a full portfolio of products available to you through our organization, so you can supplement all types of programs for a veteran where one type of coverage may be appropriate in one circumstance and not in another. There may be veterans that are concerned with the exposure that they've had to different circumstances during their service and want to make certain they have coverage for cancer. So there are additional critical illness policies you may be able to offer them in addition to whatever coverage they have. Many of the veterans may not want additional restrictions on a network-based program such as a Medicare Advantage plan, but want help on dental or vision or hearing benefits, and you have standalone benefits that can help them with that. So keep in mind the full portfolio of products that you have available, and also keep in mind the full benefit package that a veteran has. I'll show you a little snapshot of some different resource material here in just a second to help you keep in mind that that veteran may also need your help for final expense or other life insurance needs as well, because much like most people have with just a regular Social Security death benefit, there's not always a lot there for all veterans. So keep that in mind. You have a list of individuals within our organization that will be happy to help you with this information and to be aware of the advantages and disadvantages of the advice that you render. And we want to make certain that you have the information necessary to be comfortable with the delivery of that information. A few things that I'm going to pop up here really quickly. This is a presentation we have put together, the one you've just gone through with me. There are also additional presentations that are available, made available by different carriers. For example, this presentation is made available by United Healthcare. This presentation, if it comes up here, come on. Pardon me. There is another presentation available for individuals made available by Humana as well. There are some additional pieces of information that might be helpful to you. This is a program that was put on by the Veterans Administration that goes through and gives additional contact information and additional information for dealing with the veteran population, making certain of the overall type of benefits that they have available. Pardon me, I'm running out of memory here. You also have that you don't need. Other pieces that are available, we have a veterans aging into Medicare piece that would be helpful in many circumstances. That is being made, recorded and made available to you as well. Is a recording in addition to the PowerPoint that will come to you, and some other access to, here we go, other pieces that will help you field questions properly from the veteran. So you have an overview and some different fact sheets that can be very helpful for you. This is the piece that I was referencing earlier, dealing with TRICARE and for those folks turning 65 into Medicare. So as follow-up to today's presentation, you'll have access to additional documents made available to you. That said, what I'd ask you to do is watch for the follow-up that will come to you from your marketing team. Keep in mind that we are available to you as a resource for information available in these circumstances. We have had experience with folks that have dealt with different VA delivery systems, so there may be some things that we can do to help you in the marketing to this particular segment of the Medicare world. That said, I appreciate you coming on the line and spending some time with us here today. If your question was not answered through the course of the presentation, I will make certain that you have that information made available to you as part of the follow-up information sent to you individually. I want to thank you for coming on the line and spending some time with us today. We look forward to speaking with you in the near future, and we wish you happy selling.